I now want to move on to our Lyme cases, true Lyme cases, serologically confirmed, that we have seen in southern Hampshire over the last 20 years. Because since I've been a consultant in Winchester, we have tried to actively seek out every patient who has Lyme disease from our local GPs, from those that are referred up to hospital, so that we've got a good picture of what's going on locally. Because as I mentioned, it's not just the New Forest, it's certainly many areas over the south of England, and the incidence is I think genuinely seems to be rising. So this is about 20 years of confirmed Lyme cases, and you can see it would appear that the numbers are going up. Now, is that a true rise, or is that just related to better diagnosis? I think there is a true rise, because we were just as interested in the early 90s in Lyme disease as we are now, and we were actively seeking cases from our GP practices in Hampshire. But there weren't that many cases, and I don't think they were really being missed. So I think there has been a genuine increase in the south of England in Lyme disease, possibly related to increased housing development in rural areas associated with woods, and possibly more exposure to the countryside. I think another reason might be that there are more vectors out there. I mean, not just ticks, but the intermediary hosts as well, which are not just deer, they're small mammals and indeed pheasants. At this time of year, with the shooting season starting in Hampshire, you can hardly drive along a road without running over a pheasant, because the numbers of birds that have been put down specifically for game shooting are huge. They all carry ticks. They're known to carry Borrelia as well. So there are many different hosts out there in the countryside. So I think this is a true rise in incidence. And this is the same numbers, but this is translated into incidence per 100,000 of the population. Now, if you look up the PHE website, the national rate of borreliosis in the country is 1.7 per 100,000. But you can see in some years in our area of Hampshire, we have 10 times that, 18 per 100,000 in the population. So I think that is a genuine increase in incidence. But that's nothing compared to other parts of Europe. And this is some data from other countries in Europe. 206 per 100,000 compared to our 18 in Slovenia, based on laboratory reports, and 135 per 100,000 in Austria, again based on physician surveys. So very high. You're all aware that it's transmitted by exoded ticks. And we've asked all our patients over the years, have they been bitten by ticks? And just over 30%, almost 40%, have had a definite tick bite. They've identified the tick and removed it from their body. Another third are not quite sure, but they think they've been bitten by something. And a third don't report any tick bite. Virtually all our cases are locally acquired. Some reports say up to 20% are acquired abroad, but in our series, only 5% were acquired abroad. And the rash can be very variable. I mean, you see classical descriptions of erythema chronicum, this spreading bullseye rash, sometimes pale at the centre, sometimes more inflamed. But in my experience, having seen a lot of these rashes in Hampshire, they can be very florid, they can be very faint, they can sometimes look very inflammatory, and sometimes they're hardly visible at all. And so I'm just showing you a few here. This is one that appears to be fading, but you can see a red centre and a very faint expanding circular ring on the side of a trunk, somebody's trunk there. A child with nothing in the centre at all, but this very faint, again, ring, expanding ring on the side of the hip. A conservation worker, so you can be bitten anywhere, of course. He spent his time wading in reeds on the banks of the Itchen and the Test, and a tick has bitten him on the lower abdomen. And again, a variety of rashes on arms and legs that were associated with positive Borrelia serology. Age, most series seem to report a sort of a biphasic age distribution, and perhaps that's just associated with those age groups that spend most time in the countryside. But we've seen most, as you can see here, in young children, and then middle-aged folk in their 40s, 50s, and 60s. Where we've got a history of tick bite, not surprisingly, The bite usually occurs in the summer months, May, June and July, with the first symptoms, whatever they may be, following some weeks later, and a diagnosis often a bit after that. So there's a bit of a lag phase in terms of symptoms and then diagnosis. And these are the presenting symptoms of our 508 patients. 70% presented with a rash as their primary symptom, and that fits again with most series. Most series seem to report 70 to 75% first symptom being rash. Some with arthralgia or flu-like symptoms, or pyrexia and flu-like symptoms here. We've had a couple of possible cardiac cases, but it's often a little bit difficult to be absolutely sure that the cardiac problems are associated with Borrelia infection. And quite a reasonably high first presentation of neuroborreliosis. And of the neurological presentations, the majority of those are single cranial nerve palsy, seventh nerve palsy. So I really think with any seventh nerve palsy, it's worth doing Lyme serology, even though, of course, there are multiple causes for seventh nerve for Bell's palsy. Multiple cranial nerve palsies, less common. Radiculopathies, about a quarter of them presenting with neuroborreliosis, present with severe pain in a dermatome distribution. That is often quite striking. Meningoencephalitis relatively rare, and myelitis also relatively unusual. And here's some of the seventh nerve palsies resolving in various patients. Often the children with seventh nerve palsies have been bitten somewhere on the head in the scalp. So if they've had a rash, the parents haven't, neither the child nor the parents have noticed it, and they then develop a seventh nerve palsy. It can happen at any age, as you see there. And this was a remarkable patient who presented with some bizarre neurological symptoms, and it's reminded me that really with any bizarre but definite neurological symptoms, it's worth screening for Lyme, because this chap noticed some fine motor changes that were objective and demonstrable in both hands, and he was thought to have a cervical disc problem, so referred to the orthopedic surgeons, who scanned him and found this lesion in his cervical spine. And this is some years ago now, and I'm not sure, radiologically at the time, that was reported as a possible neurological malignancy. So he was referred to the neurosurgeons, who said, well, it's not really operable there. Why don't we send you to the infection doctors to rule out any myelitis inflammatory causes? And he had a battery of serological tests, of which the only one that was positive was a rip-roaringly positive Lyme ELISA. And so he came into hospital. He'd actually, by this stage, having been told it might be a tumour, had started planning his funeral. And he was a young chap in his late 30s with young children. But he came into hospital, had a few days, not months or years, a few days of IV ceftriaxone, and after about day 3 of IV ceftriaxone, he said, I just feel so much better. Not only are my neurological symptoms starting to resolve, but I feel better in myself. I'm no longer depressed and miserable and having sleeping problems. I'm sleeping better. And he then went on to oral doxycycline on about day 5. We gave him quite a prolonged course because this was such a striking lesion, and a few months later, as you can see, the lesion has resolved entirely, and he's remained well ever since, without any long-term symptoms.